Hello, nerd friends. I'm back with another video, and we're going to touch on a couple of things that have to do with end-tidal CO2, and specifically reading our capnography waveforms. Now, you'll remember that capnography is the measurement and our graphical, graph representation of carbon dioxide concentration in our exhaled gases. The cool thing about capnography is it's going to provide a real-time measurement of what's going on with your patient ventilation-wise. Another cool thing about capnography is not only can it tell you about your patient ventilation-wise, but it can also tell you a lot about your equipment if you're having some kind of equipment malfunction in your breathing system. And it can indirectly tell you about cardiac output and how things tie in there, and we'll get into it, okay? So if we look at our waveform, let's remember from the last video, right, that this is inspiration and this is exhalation or our expiration. And then when we get to the very end, right, we're breathing all the way out, all the way out, all the way out. And we get to the very end before we inhale again. That's kind of our end point there. And that's where we take that measurement. We're looking for our numbers to be anywhere between 35 and 45. But remember, we know that anesthetics can depress ventilatory drive depending on the drugs that you're using. So you may see some hypoventilation that's pretty common under anesthesia. So while we do like these numbers, it is not uncommon that we may see our end-tidal CO2 be something like 50, maybe even 60, hopefully not into 70s. But we get into like the high 50s and 60s, we're going to be providing intermittent positive pressure ventilation or putting our patient on a ventilator. We already talked about that. So let's talk about the actual waveforms really quickly, all right? So a normal waveform, here's our normal waveform right here, you guys. This consists of an inspiratory phase, which should return right to 0, okay? And an expiratory phase, this is that steep rise in CO2 in our plateau. And then we get a rapid return to baseline or 0, right? So we should see this nice plateau. A normal wave should look kind of either squarish or even plateauish or rectangle, however you like. So let's talk about some abnormalities and what you might see under anesthesia if, again, you have a problem with your patient or a problem with your equipment. So while we would like these waveforms to look like these nice plateaus, every once in a while you might see a waveform that looks like this. So here's your baseline, here's our inspiration here, and then here's exhalation here, right? So as the waveform goes up, you'll notice that it slopes. It doesn't come up really nicely like it should, right? We actually get this sloping. It's kind of having a hard time getting up to plateau. If you see a waveform that looks like this, commonly referred to as a shark fin, then you know if your patient is really kind of struggling to get up there, that's telling you there's a blockage somewhere. So we need to go and figure out where. First thing I want you to do is take a look at your patient. Are they breathing normally, right? If you have an esophageal stethoscope, take a listen. Do you hear normal chest sounds? Every once in a while, did your surgeon put the drill on the patient's chest? Sometimes they do that, right? So is there something blocking that airway or blocking that breath? Sometimes commonly we see this with like mucus plugs in the system. Every once in a while, you can also see it with a bronchospasm that really tightens up, okay? So anything that is preventing that breath from getting out, right? Or blocking that breath from coming up to plateau. I'm really having a hard time. I'm struggling getting up to plateau. That's telling me that there's a blockage somewhere. So we need to go investigate and find that. If it's mucus and we can suction it out, if we need to change our tubing, if we again need to move the patient around positioning wise, something like that. But we do want to investigate if we see this. Now, another waveform that you might see is kind of the opposite end, where you'll see that at inspiration, and then our patient exhales and we come up to plateau, but we can't maintain that plateau. We actually drop off pretty quickly. So we kind of have like an opposite shark fin. So if you're seeing something like this where normal inspiration and then exhalation, but I can't maintain, right? I went up to plateau, but whoop, I can't maintain that plateau. Why? Because there's a leak somewhere. So we need to go find that. Now, most commonly, our leak is right at maybe the endotracheal tube or the cuff itself. So if you have a patient that is under anesthesia and they've been under anesthesia for a long time, they're super relaxed or potentially even deep under anesthesia, check that cuff, right? Give a nice breath. Make sure your cuff is still holding pressure, because if you can't hold, then sometimes you need to add a little bit to your cuff there, right? So either one of these is going to tell you that there potentially is a problem with your patient or with your equipment, right? So if you're seeing either of these shark fins, you want to go investigate a little further. Now, just a side note, and we can get into this further in another video, because remember, I want to keep these kind of short for you guys. Removing CO2, so getting rid of that CO2 from the body, right? It does require adequate cardiac output. So if your cardiac output and if your patient's cardiac output is really shitty because either they're super bradycardic or they're super vasodilated because accidentally we have them on, 4% of SIBO. If they're hypovolemic, right? That's that patient that came in and they may be a little bit shocky and we haven't fully fluid resuscitated them. Remember, if our cardiac output is terrible, we're not going to be able to adequately deliver oxygen, pick up CO2 and get rid of it. So our CO2 numbers will start to decrease. Also, if you see a big decrease in your end tidal CO2 while under anesthesia, where you're going at 45, maybe even 50, and then you just get a big drop in your end tidal CO2, right? So that is an indicator that your patient is not doing well, and it can be an early indicator of cardiac arrest. So we want to make sure that we're keeping an eye on these waveforms and these end tidal CO2 numbers. All right? Hopefully that helps. Okay, bye guys.